It's been a bloody start to 2021. Chicago recorded 131 homicides in the first 3 months of the year. That's the deadliest first quarter since 2017. Now, a measure sitting on Governor J.B. Pritzker's desk, H.R. 158, declares violence a public health crisis with directives for state agencies to identify high violence areas. The bill also takes aim at racial inequities in the state's healthcare system. Joining us to discuss the legislation and its potential impact are State Senator Mike Simmons, a co-sponsor of the bill and whose district includes neighborhoods on Chicago's far north side, and Reverend Anthony Williams of King International Ministries. Reverend Williams is named in the bill and has worked to classify violence as a public health crisis for more than a decade. He lost his own son to gun violence in 2018. Gentlemen, thank you for joining us on Chicago Tonight. Senator Simmons, let's start with you, please. How will this bill tackle those inequities in the state's healthcare system?
Well, first, Brandis, I want to say thank you to State Senator Maddie Hunter, who was the lead sponsor on this legislation, Camille Lilly over on the House side, and the entire Black Legislative Caucus, with which I am proud to be a member. This legislation was the first major piece of legislation that I voted on as a state senator. As most of you know, I've not been in a seat for even 2 months at this point, and so it was great legislation for me to start out on. And what this bill does is it does a number of things. It's a pretty big measure, but a couple of key points. It requires that state agencies better coordinate healthcare across a very fragmented system, and that's going to be important for healthcare outcomes, particularly when we talk about disparities for our racial groups and for people living with mental health conditions. It also requires that there's a racial impact note that's designated in terms of the impact of legislation that is moving through the General Assembly and the enforcement agencies that are in charge of implementing that policy. And so having that racial impact note will get us to a point where we actually have some meat on the bones and some teeth in terms of what we mean when we talk about breaking through institutional racism in our systems.
And Reverend Williams, as we mentioned, sadly, you lost your son to gun violence 3 years ago. How did that tragedy mobilize you and the anti-violence community work that you do?
Well, the citizens just felt that we had to acknowledge the fact that violence is a public health crisis, and it is. The CDC has said that violence is also a pandemic and a public health crisis. And I want to congratulate our citizens in Illinois and our state lawmakers. We're the first state in the union to talk in terms of identifying and acknowledging that violence is a public health crisis, and we can't continue to live with abnormal behavior anymore.
And Reverend Williams, one of the things that this measure would do is direct state agencies like the Illinois Departments of Public Health and Human Services to embark on a study that would identify high violence communities for program funding as well as economic development. Which communities do you think would benefit from that kind of investment?
You can start off with my old neighborhood, Inglewood. You could also take the southern suburbs like Dalton, Roseland, Woodlawn, Lawndale. And so East St. Louis, it's enough to go around in terms of dealing with this pandemic of violence.
What kind of programming and economic development would you like to see for those communities?
Well, when you talk to equity, fairness, the resources going to the proper people who have measurements to show proof that they're dealing with the issue of violence, preventative programs that we need so badly.
And Senator Simmons, several of your colleagues opposing this measure have cited fiscal concerns amid the state's budget woes, of course, during a very challenging fiscal year. But measures like funding for violent communities is subject to appropriation by the General Assembly. Do you think your colleagues will follow through?
You know, the intention is absolutely to follow through, right? I mean, we can't solve this epidemic of violence in this city, in this state, and across the country if we're not willing to put our money where our mouths are. And we know that in many instances that the programs that are required to combat violence, the number of mentors that we need for our young people, the number of mental health professionals that we need to have deployed when we have people that are in crisis, where if we don't have that intervention, the outcome is likely to be a violent one. When we don't have those systemic responses in place for people that are in pain, right, then we're not going to be able to turn the tide on any of these issues. And so, like I said, I'm new to the General Assembly and I don't want to speak for my colleagues, but I think that the intention is there to, break through on these issues. I mean, we as the Reverend said, we've been talking about this issue for years, right? Defining violence as a public health emergency and having a public health epidemiological response to the issue is really important if we're going to actually make systemic progress on reducing violence across the board.
And Senator, you say you're new to the General Assembly, but we know you're not new to Chicago. What do you think are some of the root causes that lead to violence in the city?
Right, and I'm glad, that's a great question. I mean, a lot of this is just, we're talking about, in the 7th district where I'm the state senator, it's economic violence. We're talking about families who are working 2 and 3 jobs, who are expected to be able to take care of their families, and they can't, right? They don't have health insurance. They're not able to put food on the table. This is the only country where we have people working 40 and 50 hours a week, and we've become normalized to the idea that they should be able to struggle and not be able to actually take care of themselves, not be able to pay their bills. And so that's a big issue. When we talk about returning citizens in my district and many of the communities that the Reverend talked about, who come back into the communities and they're not able to find work, or they go through job placement programs where the outcomes are just not there. 6 months later, 12 months later, 2 years later, these people are still not employed. That's a big problem. And so we've got to have a structural response to those types of issues.
And we're currently, as we mentioned earlier, seeing this very dramatic spike in violence. The first quarter of 2021 with 131 killings recorded, the deadliest since 2017. Reverend Williams, do you fear that these numbers will only get worse, especially as we get into the summer months when violence is notoriously worse?
It's so important that we push. That's why this bill is so important. Civility is so sorely needed. Civility. We had to uncool violence. Violence ain't cool. And so civility is so important. That's what this bill does. Is it educates. It deals with collaboration. You're talking about structural violence, institutional violence. Civility. Civility is key in redirecting the funding to those agencies who are out there with boots on the ground. This is an intelligent piece of legislation. It is the vaccine. It is the vaccine to the violence that's occurring in Illinois. Once we pass an Illinois impact to public policies, then we go federal, and we put it on President Joe Biden's desk.
Okay, we'll have to leave it there. My thanks to Reverend Anthony Williams and State Senator Mike Simmons for joining us.